It has been revised recently just to include lessons learned from COVID-19, especially the multi-sectoral coordination approach, One Health approach. So this document is available in a revised form. So today, we have made significant progress in terms of implementing the event-based surveillance as early warning system. We have supported few countries to establish functional EBS units. Working with the experts and member states, we have developed guidelines, training materials, and standard operating procedures. And we have also tried to really, integrate some of information sources for surveillance system, including epidemic intelligence from open source. And we have established technical working groups. We have also established community of practice where countries can exchange experience. And many surveillance officers from member states have been trained on event-based surveillance program. And Africa CDC also developed an event management system, which is an electronic tool to register public health events and report them in timely fashion, and also will allow you to produce a summary report for action. And we are happy that some of the member states have started adopting those tools. So today is an important milestone in our effort in implementing event-based surveillance, because we are launching important resources, the EBS resources, which include the framework which will guide the continent to implement event-based surveillance, and we will have an event-based surveillance scorecard to really objectively assess the readiness of the countries. And we have also health information exchange policy and standards, and we have a framework and then a training package. So we feel that these are very, very important resources that will help member states as they continue their effort in strengthening early warning and response systems. So in doing so, we have been supported by many partners, many of whom are in this room. So if it was not because of your support, so we couldn't come to this level. So I would like really to thank some of the partners, and I will be happy really to mention some of them. We received a considerable support from US CDC, WHO, the East Central and Southern Africa Health Community, SACID's One Health Foundation. We had also support from university like Gondar University, and many other partners which I may not have mentioned their names here. So I think your support has been very critical. And we also received a lot of support from technical experts within the continent, in member states and across the globe. So we really value all your contribution. And the Africa CDC event-based surveillance team, our epidemic intelligence team, has been really exceptional in terms of supporting member states and implementing some of these activities. So I would really like to thank them and all of you participants for coming all the way to be with us today. And I really would like to encourage member states to use this opportunity to take full advantage of these resources. So if the resources are there and they are not being used by member states, so that is not what we are looking for. So we really will consider that member states will take full advantage of this and implement this resource. And we will follow as member states and support them as they continue implementing these important materials. And finally, let me reiterate again that investing on early warning systems is cheaper than responding to a spreading outbreak. And let's also remind you that none of us will be safe until all of us are safe. So I would like to reiterate the Africa CDC's commitment to implement these resources, and I wish you, a fruitful deliberation for the next 2 days. I thank you.
Thank you so much, Dr. Yinu. One more round of applause for him. I can see we've just been joined by Dr. Kuria, Director of the Kenya National Public Health Institute. Thank you so much, sir, for joining us, representing the Cabinet Secretary for Health here in Kenya. I've just been informed we have 2 more speakers in the room that I'd like to call up from the US CDC. Mr. Jim Zinger, sir, if you can join us on stage, thank you. And from the East Central and Southern Health Community, Professor Yosua Dambisia, if you can also join us on stage. Thank you so much. Our next speaker is George Williams from the World Health Organization. He's an infectious disease epidemiologist and health data scientist. Kindly make your way to the podium. Round of applause for him.
Okay. Good morning, our distinguished colleagues from Africa CDC, the member states, WHO, and our different partners. My name is George C. Williams. I lead the Public Health Intelligence and Risk Assessment team in the Emergencies Program at WHO Regional Office for Africa. It is a great delight to attend and participate in this launch of event-based surveillance resources. This launch for us comes as part of an ongoing marathon to build capacities across Africa for early detection and response to public health events. As you may all know, our region continues to be afflicted by a high burden of infectious disease outbreaks and other emergencies. In the WHO African region, we are currently monitoring 154 public health events, and this includes 131 infectious disease outbreaks and 23 humanitarian crises due to armed conflicts and natural disaster. These resources are a great addition to strengthen public health surveillance in Africa. We are pleased to collaborate and partner with Africa CDC and all of you, our dear member states and partners, to leverage these tools for better surveillance and public health intelligence systems in Africa. On behalf of the Regional Emergency Director at WHO Regional Office for Africa, Dr. Abdul Salam Gay, I say bravo to you, and let's work together for a resilient Africa. Thank you.
Thank you very much. Moving along, I'd like to call on James Singerza, who is from the US CDC, as well as an epidemiologist and has been with the Carter Center since 1989. Can we give him a round of applause?
Good morning, Jambo. Assalamu alaikum. Bonjour tout le monde. I'm very happy that the speakers who spoke before me spoke so well. There's really not a lot that I need to add. I have worked for, just to clarify the introduction, I guess I started at CDC in